Hello, I'm Dr. Harley Farmer, and we're now up to video 10 for the 10th chapter in my book, which is called What is Eczema? How to End the Misery Quickly. This chapter is on the 7 biggest mistakes. Now, whenever you're in a situation like this and you start mentioning mistakes, you can always be criticized for letting people blame themselves, or maybe I'm seen to be blaming them. So I know this is delicate ground, but it's also in actual fact a sequence, because we came into the eczema program, the ability to end eczema, by listening. We found out people who had done different things. Now, when we realized what they'd done, we said, okay, let's use words here. If that wasn't serving them well, then doing it, let's call it a mistake. Let's be provocative, let's get people thinking. Now, the first one of these mistakes is not knowing the effect of products on skin. Sounds simple enough. If you've seen the other videos, you'll know my concept that product on the skin, probably no effect at all. If it gets in the skin, totally different. You can get inflammation and eczema. So if you choose to ignore that and keep using these products that get in the skin, you're still making that mistake. If you've decided to learn from that, that mistake is gone. Now, the good thing I hope you'll pick out of this video is that each and every one of the mistakes is actually quite simple. You have to learn a little bit of information. Now, it's only the fact that we're bringing this information new, which is why a lot of people are seeing these mistakes now. You then have a choice for each and every one of these mistakes. Continue it, decide not to do it. So number 2 is accepting inadequate knowledge of skin and how it works. Now, it's quite a long mistake. But what we've got is the fact that skin replaces itself every 28 days, every month. Now, the skin that you can see here is not the skin I was wearing 2 months ago. Might look the same, but they're brand new cells. They've come through. So you might think, well, okay, if the skin's going to replace itself and you've got a patch of eczema, why would the skin go to all that trouble to replace damaged skin? That is understanding how skin works. That comes out of the eczema program, and the details are actually in the book. Obviously, these videos are just skimming through. The third is continuing to use products that haven't worked. Now, here I have to define my definition of worked, because if you're using a steroid cream to manage eczema, the redness goes away, you're managing eczema. It worked. That is one side of the story. What I'm saying is, if it didn't end the eczema, then it didn't work. Now, the reason this is not a mistake for most people is that, first of all, they have to come to believe it's possible to end eczema deliberately. If you don't choose to believe that, then luckily you can continue managing it. You're allowed to. 80% of children grow out of it anyway. You're only left with the 20%. Now, that's a bit of a glib statement. Only 20% is an awful lot of children. Some of those children go on to be older. We have worked with a lady who was 91 years old. So eczema can hang about for a very long time. Now, that's what I mean about products that haven't worked. It's a definition. Now, the fourth one, mistake that I see, is people not trusting their judgment. Now, when I speak to a lot of parents, they're saying, look, we have to put steroid creams on, but we really don't like them. Our judgment is that they're not doing any good. Our judgment is that that emollient is causing more trouble than it's worth. Our judgment is, and they keep managing. When they come to trust their judgment, then they get to look at some other things. Fifth, accepting the immune system was at fault in eczema. By now, if you've seen the videos, you'll know that I see the inflammation in eczema as a very good clue that something is wrong. Let's look at that something. If we stop causing it, stop putting on those products, then there's nothing for the immune system to react to. If you stop causing eczema, there's no inflammation. It's that simple. Takes a bit of thought, takes a bit of conviction. Therefore, I think accepting that the immune system was at fault is a mistake. Now, let's move on. Fostering a negative belief around suggestions that eczema can't be cured. There are an awful lot of people on that side who are saying eczema can't be cured. If they're causing it, they're right. You're not going to cure something with what you're using to cause it. Provocative. What I'm saying is, if you keep your thinking over here, you'll stay over here. Most people do, so you've got safety in numbers. What we're doing is giving people an opportunity to say, right, what if I was to move on? Then that mistake is broken. The last of the 7 is failing to question authority, like the official guidelines. Now, if you're a parent with a child with serious and severe eczema, you should listen to the dermatologist. Please do, because that child is in a terrible state. You are, however, allowed to question the knowledge that they give you. Now, as it happens, not that long ago, dermatologists were quite rightly prescribing aqueous cream for use on eczema. Then an article appeared in a very prestigious dermatology journal that said that product is wrong for childhood eczema. Now the dermatologists are saying don't use it. Now, some of us who knew the ingredients in aqueous cream for years, we've been saying, please don't do it. But we're just rocking the boat. They were following what they saw as their professional best practice. Therefore, the parents were following it too. Now, the parents who understood enough chemistry were saying, this can't be good. Now the dermatologists are agreeing because it's appeared in a journal. Everything else that's being done on this side, I think, is open to question. Equally, anything I'm suggesting over here is definitely opening to question. Because people who agree with us, it's nice, feels good. People who challenge us improve our knowledge. That's why we worked on this eczema program for quite some time before we went public. We still get people saying, you know, you're making the mistake, you're misleading people in suggesting this, and we're saying, fine, leave most people on this side managing. If they want to look at each of these mistakes, and in the book I invite them at the end of every mistake, sit back, say, right, did that make sense? Do I want to challenge it? If there was nothing wrong with it, maybe it was right. And if after 7 questions you say, interesting, none of them were wrong, I'm not doing any of them anymore because I've now decided not to, you're suddenly on this side. That's the opportunity. So that's the end of that chapter, and I hope you'll join me now for chapter 11.